I'd like to cross to our correspondent, Bénédicte Paviot. She's standing by in London. Bénédicte, it's great to have you with us. Though it's a very challenging subject to keep talking about, it really appears as though the UK at this stage is trying to step up its vaccination efforts, isn't it?
Oh, yes. I mean, the word historic is often abused, but in this case, it is absolutely accurate and impartial to say that. This is the biggest mass vaccination program that this country, the United Kingdom, has ever seen, and by some, as you said, quite rightly, over 2.6 million people have already been vaccinated. Of course, you all know that there are 3 vaccines that are authorised here in the UK. The first one in the UK and indeed in the world to be authorised was that Pfizer-BioNTech vaccine. Then a few weeks later came the Oxford AstraZeneca one, and then the most recent one to be authorised is the Moderna vaccine. And today, a very, very modest start involving pharmacies, chemists across England, just 6, and when I say 6, I literally mean 6 individual chemists have started vaccinating people from priority groups with this anti-COVID vaccine. And of course, chemists are very used to playing that role in communities up and down the UK, also used to giving that expertise, that experience, the yearly flu jab. So it is absolutely proper that they be involved. The hope is that 200 pharmacies will be in the next 2 weeks, and then to roll it out, of course, across the UK. And when you know that the figures were so grim and that we reached a new record of deaths yesterday in the UK, a further 1,564 people died within 24 hours, and over 47,500 new cases of people infected with COVID, you see how pressing the need is.
Indeed, and Bénédicte, the numbers that you just mentioned are extraordinary, and we keep reading and hearing about the National Health Service and the country being overwhelmed. Can you share your own insights with us and our viewers?
Yes, so if I talk nationally, I can say that the surge in COVID hospital cases is now deemed to be having a terrible, calamitous effect. That's not my personal opinion. It's the national surgeons who are saying that. Personally, I, alas, experienced that 2 weeks ago, rang the emergency number, which in the United Kingdom is 999, discovered that I was not talking to an ambulance service in London, which would normally be true in the British capital in the 21st century, indeed long before that, and in this extraordinarily normally good National Health Service, but that I was talking to someone in the East Midlands who was going to relay that message for one of my family members to London. And instead of there being a 15, 20-minute wait possibly for an ambulance, I was told they couldn't give me an estimate. It could be 1 hour, could be 10 hours, could be 12 hours, could be 18 hours. We went to the hospital, and what's interesting to see, and this is in the west of London, Charing Cross Hospital, was that it was divided between a COVID and a non-COVID emergency department. They were understaffed. They were so willing, so tired. So many of them are suffering from PTSD, from burnout. Some of them are self-isolating. So under huge, huge pressure and trying to not let the hospital just be a COVID hospital. And that is the challenge for all the hospitals across the United Kingdom, and I would imagine across the world. So cancer treatments being cancelled, operations like hip operations, which pose mobility problems. And the grim reality is that the numbers are going to get worse here, but that huge hope in vaccinations. But before that, the huge need for people to stay at home. That is the government. It is doctors, nurses going on Twitter, on social media, pleading with people to stay at home unless they absolutely need to leave their homes and to limit their social interactions. I think that's a worldwide, probably good advice, isn't it?
And perhaps a message we need to relay here once again. Please, please do stay at home. Bénédicte Paviot there with that very harrowing account of the country's National Health Service cracking under pressure. Thank you so much for speaking to us.